Hey everyone, this is Mayor Wallace. We're going to get ready and start our Tele-Townhall regarding COVID-19 in a few minutes. It's going to give everybody an opportunity to be able to get on. All right, I think we are about ready to go. Again, thank you for those that are tuning in for this Teletown Hall regarding COVID-19. I'll be kind of leading this engagement with the community. We also have Dr. Royce Avery, our superintendent for the Manor Independent School District. He has some of his team members on here as well, and I also have our city manager on to assist in answering any questions that you all may have regarding the current shelter in place, as well as some of the things rolled out through the school district. So really the intent of this Teletown Hall is really Q&A. Whatever questions you all may have, in addition to resources and information already pushed out by us on the City Hall side, as well as the school district, really to just provide any additional clarity and information that you all may need to have a better understanding on some of these new restrictions and policies. So with that, Dr. Royce Avery, do you have any remarks to add before I hand it over to Angel Vidal to go ahead and coordinate any potential questions?
Thank you, Mayor Wallace. Again, this is Dr. Avery, School Superintendent of Manor ISD. Again, community, I just kind of wanted to kind of emphasize that throughout this whole process, Manor ISD will be providing updated communication to our parents and faculty and staff through our website. And so if you could direct your attention to Manor ISD website, we will provide on a daily perspective updates regarding to any school-related, issue that you may have. We have several frequently asked question areas on that site to be able to kind of clarify some of the questions that may be wanted answered by our families. Again, want to just direct everyone to www.manorisd.net for additional information about the school district. Thank you, sir.
All right. Angel, do we happen to have any questions yet? I don't believe so.
At this time, we do not have any questions, Mr. Mayor.
All right, cool, no problem. As everyone knows that we have the current order in place, shelter in place, and I know for quite a few of individuals, we're wondering, what does that mean regarding outdoor activities? Does that mean situations like going out and golfing, the kids going and playing around in the park? when we look at that as a city, we are really talking about being open to everyone in an aspect of some people see golf as a stress reliever. There are some things that kids are going to need to be able to do as stress relievers as well. So knowing that the social distancing is an effect of 6 feet, so one person per golf cart, and then going out there and making sure you're keeping the social distancing. Sometimes it may be hard to identify whether or not 3 or 4 kids playing together at a park, maybe family members, or may at home be together. So it's not that big of a gathering or informal gathering. Some of these things we're going to have to really assess and make that assumption of whether or not this shelter in place, this 6-foot distancing, as well as what is considered going out to release some stress from being somewhat isolated in the house, to just total disregard of the social distancing ban. And with that, if you need to, and you actually see something that is legitimately violating, and I want to say violating, but legitimately not adhering to the recommendations of social distancing to mitigate or slow down the spread of this coronavirus, then you need to reach out and call the police department. And Tom, do you have anything to add as far as some of the things regarding calling in and messaging a concern like that? I think you might be muted, Tom.
I think it's going to be a little difficult if we've got 3 or 4 kids of one family playing in the park, determining whether or not they are family. And so those are questions anybody can ask. What we don't want to see happening is a pop-up football game or something else where we've got a bunch of kids in the park. Playground equipment is supposed to be off limits, and I know we are trying to tape off some of the equipment that we own in parks around the city. That may take a little time. With regard to the golf course, I know people have been calling in or upset about that. Just wanted folks to know that the owners of the golf course had contacted us as soon as the shelter-in-place order went into effect, and asked whether or not they would be considered a park. And there were concerns that we had with regard to sharing carts, maintaining the 6-foot distance. All of these things were agreeable by the owners. I think we're still working on addressing some of those, and we will continue to do that. If we find that there are violations of these orders, we're going to have to shut it down. There just isn't any other option.
Thanks, Tom. And our city manager said something very key. We're heavily relying upon each individual to self-police themselves, or to show that self-restraint, right? Because none of us really know who has and who does not have this coronavirus. And as we try to just slow down the spread until a vaccine is available to neutralize it. And when you're talking about the aspects of giving people or owners, business owners and locations kind of that ability to assess how they need to manage that social distancing, just know if there are multiple reports of a violation, I have given the authority to our city manager and to our chief of police to shut it down. And then from there, a request formally through your organization or your business through City Hall to me to reassess the situation. So we're doing this Tele-Townhall to really make sure everybody understands what the shelter in place means, what it means in some of those gray areas that people have questions regarding the shelter in place, and how we are reviewing and assessing it case by case and overall from the city of Manor.
Mayor Wallace, I have an additional add to that particular question. This is Dr. Avery. We've had several questions about the use of our facilities as well, tracks, football stadium, football fields, that kind of thing. But I do want to emphasize to the community as well that all Manor ISD athletic facilities are closed off to the community. And so we are not prohibiting anyone to walk the tracks or play on the fields at the time. We will be reassessing that as some of the restrictions are lifted, and we will notify the community as well.
Appreciate it, Dr. Avery. And, UT.
Mayor Wallace.
Go ahead.
I apologize. Dr. Avery, I believe you said we're not prohibiting, but I believe we are prohibiting the use of facilities. I'm sorry. Am I correct?
Yes, Dr. Vera, you are. I caught that as well.
You are correct. When we are not allowing individuals to use the facilities, just for clarification.
All right. So I'm not sure if everyone had a chance to see the Austin Round Rock data and statistics that were being forecasted by UT Dell Medical. And with that, they're forecasting that the spread of the coronavirus happens, it doubles almost every 4 days. And with every single person that currently may be positive with that coronavirus, on average, they are unfortunately infecting almost 2 other people. And currently now the incubation period, which used to be about 14 days, has gone down to about an average of about 7 days. And, when they showed these numbers, and I shared it on my site, I shared it with the team that's on the call right now, they're looking at what we were doing before the shelter in place was trying to mitigate a reduction by about 50%. And with that forecast of trying to reduce the spread of this coronavirus at a 50% action plan, we were looking at this, what they call it, the curve of the max number of potential people infected during this wave to go out almost until in the summer. So with the shelter in place, is more of a stronger aspect and effort to create a 90% situation of less contact. And with this 90% effort versus the 50%, which was, no more than 10 people gathering, now with this shelter in place, this 90% effort to reduce the spread of the virus is hopefully going to be able to make that curve, as many people that end up getting this infection, this initial kind of a wave, for it to prolong even longer than summer. And some of the additional information that they provided dealt with hospitalizations, ICU beds, and the use of ventilators for some people. And under this 50%, where we're at just 10 people or more gathering together, they had almost across the board us maxing out our hospitals, our ICU beds, ventilators for those that would need that would need assistance in breathing and respiratory stuff. They were looking at us almost maxing out all available use of those things by the middle of May. And so with this 90% now increase to social distancing, we believe if everybody, and this is a belief across 5 different counties that are trying to work together now, we believe that if everybody takes this shelter in place seriously, that we can potentially be able to reduce and mitigate the bottlenecks within our hospitals, ICU beds, ventilators, and so forth, all the way hopefully to the end of the summer. So it really becomes very important and crucial that everybody understands why we're saying self-police yourself on this ban. Don't go out and congregate. unless it's critically crucial, right? Because we're trying to make sure our nurses, doctors, physicians, and so forth, one, don't get overly taxed out and stressed out and potentially decide, they want to quit, or they end up having mental health issues. But then two, trying to make sure our own national services and support structures and systems do not get overpopulated to where they cannot take care of those that really would need to be taken care of. And with that, there are things that we're trying to do here within the city as far as additional measures to help out our county entities. We have individuals working on different task force in response to our emergency management plan. One of those is what Ms. Monique Celadon is doing with the support and assistance of the Manor Lions Club with helping out our elderly population. They've even taken a step further to help out pregnant mothers and mothers with infants and those that are physically handicapped. So Monique Celadon is actually kind of spearheading two of our task force, one for food assistance and the other one for coordinating volunteers. And with the volunteer aspect, we also have one of our council members, Dr. Chris Harvey, who is serving as our FEMA and legislative coordinator to ensure that these organizations are well informed on the paperwork, the tracking, data tracking, and things that need to occur. So when and as needed, they can submit their reimbursements to hopefully be able to receive funding to keep their efforts going. And also, he's kind of the connective tissue to make sure that the city can assist where possible and as best as possible. Another task force is led by Dr. Karen Smith. She's leading our health efforts, and she's working arm in arm with the county Health and Human Services. She's working with community care, with Baylor Scott and White, Austin Regional Clinic, and ESD 12 with Fire Chief Ryan Smith. We found out a lot of the efforts that she has already put forth coincide and overlap with a lot of what the ESD 12 has in place. So within the next couple of days, we're going to be refining our internal planning efforts to make sure we're not wasting efforts, resources, where those efforts and resources are already allocated. And we also have Father Alex, who's leading our faith-based task force. And the intent behind that is to establish a one locale for any type of support that we may need and you may need during this time as this shelter in place is going on. Some of us may need to vent. Some of us may need to talk to someone. So Father Alex and his team is going to take on that effort on behalf of the city. So people have a place to be able to reach out to of individuals that have gone through seminary school, that have gone through other different types of formalized training and experience to be able to provide that assistance and guidance. And then we have our school district task force, which is led by Dr. Avery. And that effort is really just making sure the school district and the city hall, City of Manor, City Hall is very abreast of everything that's going on, and to be able to assist where possible as well. And Dr. Avery, is there anything you want to add just in regards to the school district task force?
Yeah, thank you, sir. I think one of the things that's important that we are actually working with, our state agency, Texas Education Agency, on. I have a daily meeting with the Commissioner of Education, and also working with surrounding superintendents and districts across Central Texas, trying to make sure that we can kind of coordinate our efforts as school districts on behalf of the children that we serve within our school districts. And so it's a constant battle to try to make sure that we're encouraging families to support their children. We're encouraging families to support teachers and administrators in all district administrations, because this is the first for many of us. And so trying to coordinate and trying to support and implement, food service and academics, strategies and online learning and technology and internet access and all these integral parts to make it, whole for everyone, to make sure that we can, again, with safety being the number one perspective of all that we do, it's very tiring and very strenuous on everybody, including our own individual families. So again, I want the community to know that we're trying to make sure that we communicate very effectively, and making sure that we provide the necessary services for families to continue the academic growth of our students across our district. And in the meantime, still trying to make sure that we're keeping our staff safe as well, because that's an integral maneuver that from the start of this whole pandemic, trying to make sure that we're doing it in a way that we keep our staff safe as we still try to deliver those services. And again, I think you mentioned, Mayor, a little bit ago about the extent of the awareness of keeping COVID-19 at bay. I know this community, we just released from the school district that we have extended our school year up until May 1st. But also, we're also, looking for guidance from state and federal officials regarding making sure that if we have to extend further out into the summer, we can do that. TEA has reduced the requirements that we have, regarding attendance, makeup days for kids. They have provided guidance on the financial side of how we keep our employees paid, in addition to some of the requirements from the federal side that has been reduced on what we can do for feeding kids or not feeding kids. So all those things are going to be, communicated through our webpage and through our parental portals as well. And so we want to make sure that you stay connected with the district and what we're doing. So again, we have extended school up until May 1st with the possibility of not coming back at all. And that depends on, in the next few weeks, we'll have a more defined time frame for parents to be able to decide that. One of the other major issues that the district is dealing with right now is for our graduating seniors. Today, I will be sending out a video to our 2020 seniors, both at New Tech and senior high school, early college high school, and MEA, just to kind of give them a little bit of encouragement to this is not the norm for a graduating seniors year, with this pandemic. And so we still have not made any final decisions on prom or graduation at the moment, but I want the community and I want the graduating seniors and their parents to know that we're working behind the scenes to figure out some options for our families, and we'll be doing that shortly, and then we'll be coming back and communicating what we're going to do and how we're going to do it to the families coming shortly in the upcoming weeks. And so again, there's a lot of moving parts from the school district side, but we're going to try to make this year as memorable as we possibly can. But again, we still have some things some hurdles that we have to jump over in order to make that happen. So graduating seniors, hang in there, support your families and making sure you take care of the younger siblings, and mom and dad, just know that we too are going to have a plan for our graduating seniors as well. Thank you, Mayor.
No, I appreciate it. Tom, do you have anything you want to add regarding the different task force and some of the things you're thinking about from the city hall aspect of it? Because I know we talked yesterday, and so people just kind of know that I'm kind of looping people in and bringing people in because they have their own area of subject matter expertise. And even though there's certain plans and visions that I'm in contingencies that I'm kind of wrapping the team within, they are the ones that are really trying to figure out what can and can't be done through multiple different restrictions, budgeting constraints, and also trying to piece together things from a public-private collaborative effort. I think you muted again, Tom.
Forgot about the muting. Sorry about that. I think most folks realize at this point that we have closed the lobby at City Hall. We've done that at each of the municipal buildings, Public Works and Police Department. With that, we know bills need to get paid, and we know that some folks who would normally prefer to come in and pay utilities by cash may find that more difficult. And in order to try and accommodate some of the concerns about credit card fees, council has waived those through May 1st. We are not looking to shut off utilities. We expect that bills get paid on time, but we won't be turning anybody off through this crisis. You know, Chief said it this way: act as if everybody is positive and maintain your boundaries, and we should come out of this fine.
Great, I appreciate it. Angel, I think we had about 2 questions. You mind going ahead?
Yes, we do have a couple of comments here. First one coming from Maestro Getz, saying some students sometimes don't follow directions. Take dress code at a high school, for example. Baseball caps, ripped jeans, small rules of school / big rules of life, right? Some students follow the school policy, some don't. What about a high school student working a job? A manager says you have to wear a hairnet or you can't wear sandals or nail polish. Some keep their jobs, some don't. Shelter in place, question. Some students will follow, some won't. What is the difference here and now? Why is shelter in place different?
Right. So the big difference between shelter in place is there's some legal aspects that can be enacted. And more so, unfortunately, what we don't want to do on the city hall side is have to further restrict things or shut things down. That is the legal authority that we have through the local state of disaster. Anything that we deem to be in violation of the order can incur a fine of $1,000. Also, anything that could be jeopardizing public health can be shut down. Unless it's considered by City Hall or higher, meaning higher county level, state level, national level, as an essential business. So it's really more so of do what you need to do it the right way, so the city does not have to go above and beyond the current restrictions on individuals can do with the shelter in place. Tom, you have anything to add to that? I don't think you have. Tom, anything to add?
No, again, you know, these are orders that come from above and are enforceable with, as the mayor said, penalties. And so how this is different is that we have authority given by orders from various levels of government all the way up to allow us to make sure that people are protected, and we will take whatever action necessary to make sure that happens.
Mayor Wallace, I can add a little bit to that. Yeah, I think for the most part, for school age students like high school students, one of the things that we do in schools every day is that we try to, again, put out those individual things that we hope that kids will be able to do and adhere to. I think most of our kids in Manor ISD, most of the young teenagers, they understand, the wrong from right. And so our hopes, again, is that we've taught them the things and hopefully understood and explained the things that they may not necessarily want to do, but they know it's the right thing to do. And I think hopefully, with this whole pandemic, I think a lot of kids have stepped back and truly realized that this is not the norm, and we have, as young adults or young teenagers becoming adults, this is a life-changing experience for them that will carry through to their adulthood. And so I hope that they too will be able to adhere and understand and know that it's not the norm, but it's something that it has to, in order for us to save lives, we have to do things in our lives to be able to shift from the norm to make it right. And so my hopes, again, as school superintendent, that our students will adhere to the rules and the restrictions and make sure that we keep themselves and their families safe.
And, let me give some data points here real quick. So I believe it was yesterday I posted the age breakdown from the Travis County's new public dashboard. And this came from one of the requests that a couple of us had on a call with Mayor Adler's, individuals from Pflugerville, and the county judge. Every now and then we usually have a get together before any information officially comes out. And so if you look at those age categories, you're talking about between the ages of 20 to really say about 40 or so are the individuals that are coming positive with this virus. And so potentially by allowing your kids just to kind of go out and hang out with the other kids in the neighborhood, you do not know if their parents may have it or not. So your kid could potentially be bringing that virus into your house and for you to get it. Now, what stats and numbers say from my different phone calls with White House senior administrative officers, with the Congressional Black Caucus, and with the African American Mayors Association, you're not only talking about every person that's positive with the case can spread it to potentially 2 other people on average. What you're also talking about that in numbers is most of the younger individuals, younger age groups that are being hospitalized are actually having serious issues where they may have their liver or their kidneys have some type of damage. So that is some of the side effects with the younger ages. But then you're also talking about these younger kids that may be positive or not really showing any type of symptoms, and they're engaging with the elderly population. And we all know that the fact is not the sense that the elderly population get the virus more than any other age group. It's the fact that they are 28% more likely to potentially die from receiving this coronavirus. So it's kind of key is how do we make sure when you hear taking care of our elderly population, how do we make sure that even as though they're staying quarantined within their house, as we have people donating food and so forth and taking the proper precautions in distributing those things to them, that their grandchildren or their young children that engage with them are not accidentally passing this virus on to them. Any other questions, Angel?
Thank you, Mr. Mayor and Dr. Avery and Tom. So we have a couple more questions here in the chat. The second question coming to us from Ms. Lakeisha Small asking, is there a Manor COVID-19 donation relief fund to help support some of the task force initiatives discussed, or is the city sponsored, supporting the elders, single parents, and mental religion health?
Absolutely. You have Monique Celadon that has a disaster relief task force. They have coordinated to be able to receive some funding, and we're still talking with her and her team to iron out just some contingency plans as far as, once those funds and things are received, what are to be done with them once we hopefully, and hopefully meaning quickly and soon, are able to move on from this COVID-19 virus. So I would say reach out to the Facebook group, the Manor Texas COVID-19 Disaster Relief Group, that's led through a personal request from me to Monique Celadon. And then Tom, do you have anything you want to add?
You're correct. We have volunteer groups set up, and they should be contacted. We will do what we need to do as conditions warrant. We're in the initial stages of what this might look like on a volunteer level, funding level. The game plan is going to change as we muddle through this.
And Dr. Avery, anything to add? Because I know Rebecca Lott is doing some things and is coordinating and working with Father Alex in the faith-based side.
I'm going to let Becky Lott, she's on the call as well. So Becky, if you can kind of unmute yourself and kind of give a little short brief of what some of the volunteer pieces that we have from that side of the house.
Certainly, I'm happy to do so. We're thankful that we have some businesses around the area who do want to support the Manor COVID-19 Relief Fund. I've been in communication with Monique about one of them. So as we move forward, we're wanting to support the needs of the entire city while also supporting a lot of the requests from parents in the community of students. So we have Hope Austin. You may have seen that on Facebook. It's an nonprofit that's supporting our district and providing food for families who live along the Decker Lane corridor. So we've been distributing those food items this past week, and we'll receive another donation here in a couple weeks. But more importantly, too, we have a hotline, Manor ISD hotline number. It is 512-278-4095. And parents may call with any questions that they have. We're assisting families with resources, connecting them with financial resources that we have available through the district and through Travis County and Manor. So we're receiving lots of calls. Beyond that, we have our nonprofit organizations who are still responding to the needs of our community. For example, communities and schools, the social workers assigned at 11 of our campuses are making calls every week to check on their students, assist them with the resources that they need. Integral Care, our mental health therapists, are following up with all of their students and ensuring that they are connected and they have somebody that they can talk to, and then the therapists will respond accordingly. Beyond that, we have our counselors in the district who are following up with all of the students that need the additional support, our parent liaisons, as well as our social workers. So if you call that line, feel free to leave a message. If we don't answer immediately, we will follow up with calling the parents back within 24 hours.
Thank you, Ms. Lott. In addition to that, Mayor Wallace, I think one of the things that's really important to the school district is that our employees have an avenue of reaching out as well. We have an employee assistance program that we are launching out to individual staff members in our district. We're all staff members in the district, in order to make sure, because one of the integral parts right now is that our staffs who are also parents are taking care of their parents, are have the ability to be stressed out and really needing someone else to talk with as well. So we have an internal employee assistance program that we are also pushing out to our staff in order for our staff to have a little have an opportunity to be able to talk to someone as well. And so those are key things, because this is a very trying time for all individuals, and so we don't want to miss anyone to be able to have that support, be it financial, be it just the stress of not knowing how what this pandemic is going to impact them and their families. And so those are very key points. And so one of the other things that I, as school superintendents, I want to stress to this community that one of the integral parts of the backbone of Manor ISD is our school board. The school board has rallied around the school district and have provided authorization for me as school superintendent to do whatever's necessary to provide the needed services and programs for our students, and any services and support that our staff, employees across the district is needing. So I do want to extend a huge thank you to our school board because they've been very integral in providing the necessary support for my school administrators. And I can tell you, school administrators, executive cabinet, principals, teachers, counselors, food service workers, maintenance, individuals, every single employee in this district has showed, a remarkable stamina to be able to do what we've done for this community. And so I'm so proud of them, so proud to be in front leading these group of individuals, because no one individual could do this alone. And this tells you the magnitude of what Manor ISD is built on. And we're so proud of each and every one of them to be able to stand with me, stand with the board, to try to do the best for kids in this community. And so we're so excited for them. And so I want to give everyone, out there a round of applause for doing what you do. And plus, I think the community of Manor has been superb, from the city to our families, to our businesses. They rallied around everyone in Manor to do what we do. And so I'm so proud. Mayor, your leadership has been phenomenal to try to keep all these different task forces together and trying to pull from state and federal, informational sources and gearing that down to those couple of task forces to do what we do. And so I applaud you as well and your team. And it is just what a great feeling to have every one of the entities that in Manor come together for the betterment of this community. So thank you for that as well.
And thanks for your remarks, Dr. Avery, and for everybody that's listening and those that will be listening, hopefully as posted. The key thing here is, and I appreciate exactly like Dr. Avery said, the board, signing that resolution and the board really just taking that kind of step back through the guidance that I've had with with Elmer Fisher and Monique Celadon, Dr. Avery, and some others of, hey, we got to really streamline this process. As you've heard from Rebecca Lott, there are a lot of organizations trying to do things. And one of the things we're trying to do from the city side is make sure everybody's efforts in volunteering, everybody's efforts in donations and so forth are done in a way that we're not duplicating efforts and breaking down the ability to really maximize the level of support the community is wanting to give and is responding to give. And so with that, we officially have six heads working 6 different things. And as I said again, volunteering is Monique Celadon. So if you're interested in volunteering in any form or fashion, that is Monique Celadon. She has a list that's being created to track who wants to volunteer and what their areas of interest are. And that's going to become crucial and critical as, you know, individuals like Dr. Karen Smith, who's running our health efforts, may need people with certain skills and experience to help in her areas that she identifies. Or the same thing with Father Alex and Rebecca Lott when it comes to some of the faith-based stuff of support and assistance in those areas. Or even with Dr. Avery and his team when it comes to the school district aspect and how to continue improving, as we say in the military, the foxhole, or continuing to improve what we put in place already to be better and better every day. They may need people that are homeschooling their kids, that are in other different types of systems and structures to share with them some practices elsewhere. So they are always receiving additional information to be able to help out with what they're doing. And then at the same time, we have this lost off the top of my head. No, we have Councilman Dr. Harvey, Chris Harvey, who's, you know, really tracking everything down from FEMA guidance so we can look and inform each of these entities, our small business owners, our local business owners, on the best way they can potentially get reimbursed for their expenses of trying to support the community. So for me, I'm directly talking to 6 individuals. Those 6 individuals have an internal team of 3 to 5, and that internal team of 3 to 5 is coordinating the efforts within their own individual line of efforts. And so as you decide that you want to come and try to assist and try to volunteer, or who do you donate to, just know, reach out to them first, because they'll be able to tell you who may be the better individual providing a particular type of service. Because where we're at right now is trying to maximize everybody's zeal and desire to support this city during this time when we do not know when this pandemic will end. With that, Angel, any additional questions?
Yes, sir. We do have a couple more here in the queue. Let me scroll back up so that I can see them. So one that we have here is from Cecilia Alice Wolf asking, how is a parent who's considered essential working 12 hours a day going to be expected to also come home and teach their kids on top of everything else? Because I got an email stating that we will need to complete packets.
I'm going to let Michael Perkins answer that question. I think he has some insight and some information for parents to guide them from a campus level. Mike?
Yes, thank you, Dr. Avery. So we understand that families are facing various challenges during this time, and that's why we've attempted to create learning supports and activities that are flexible for students and families. Now, print packets are simply one aspect of that. So if you received communication around print packets, it was to communicate that those will be available starting on Monday for families who may not have technology or internet access in the home right now. And as we continue to develop the academic continuity plan, we are doing so with that in mind, that families are at various stages and have various challenges, and we will continue to be as flexible as possible. Additionally, we will be making other supports available coming soon, and where you can call in for academic help hotline and reach out to your student's teacher for additional instructional support.
Thank you, Mr. Perkins. Dr. Yearwood, do you have any additional things that you want to kind of put out? I think one of the things that's coming up is more, academic support. Manor ISD will be supporting families, hopefully, at least up to May 1st and beyond. So if we push school to the closer to the end of school year, we will still be providing meals and academic support. So you want to talk a little bit more about those supports as well.
Sure, yes. This is Dr. Yearwood, Assistant Superintendent for Academics. Starting on Monday, we will be sending home physical packets, but we will also be providing what we call an academic helpline for those who aren't able to help students. We'll be setting those hours up, and those will be posted on the web by next week. So anyone that needs academic help can call in, and these individuals will either be able to help or route you through an individual that will be able to get you some help. Also, our teachers will be available online starting on April the 6th. The expectation is that every teacher will be contacting each child in their classroom and establishing protocols such as teacher online office hours, as well as lessons. And the interactions will start on April the 6th and will continue until the end of the school year. So that's very, very important. We'll also be looking at deploying or looking at internet services and availability, because we want to make sure that we have an Manor ISD. It's important that our superintendent, it's very key to him that we have an equitable approach, so that way all families, whether or not you have access to the internet or not, you will still receive a quality education, and we can continue the education process in Manor ISD. That's all I have for now.
Thanks, sir.
So, I would like to add and say that, please keep in mind that the order and the guidances that are coming down are not going to be perfect. We are really working at a 75%, perfect solution here. So we not delay things when we know, not giving any type of guidance, not giving at least something that can be usable by majority of the population only allows this COVID-19 virus to spread. And things like this that you're presenting as a question definitely enable us to go back and try to figure out and say, you know what, we probably didn't really think about that, or we did and we got sidetracked by something that popped up, right within the next 30 minutes, a meeting or a brief, and just unfortunately we're not able to get back to it. I could say too that with a lot of the community calls that I've been involved with the last couple of weeks, there are community members, and even when I was talking with a lot of the mayors across the nation, we really have to work this from a dual perspective. There are things top down for guidance, information, support that we need to advocate for, we need to expect, and we need to seek for. But then at the same time, there are bottom up things we have to do. And that means we can't wait for certain things. How can we find our close friends and family members that we know are not positive, that we can rely on them to watch our kids? For right now, my son and my daughter is with my dad and my stepmother, so that I can be able to be on this call. So how are we connecting? And it's going to be so crucial now to connect with each other, our neighbors and co-workers and so forth, to find ways to fill in the gaps where the orders and the guidance and direction from Manor Independent School District, the City Hall, the county, happen to not have a resolution yet. Back to you, Angel.
Thank you, Mr. Mayor. We'll have another question here from Ms. Emily Hill asking, should there be a known case where someone is sick, what is the first action to take? Is there an ambulance, or should it be better to take that sick person themselves just to be safe?
I'm gonna throw that over to Tom because we just talked about that yesterday.
It's hard to know exactly how to answer that. If someone is showing symptoms, you should be reaching out to your medical provider. I know that the offices here in Manor, ARC and Baylor Scott & White, have protocol for talking with potential positive tested folks. And so I would look to those services first, your healthcare provider. It may be that some other arrangement has to be made to get them for testing. you know, it's going to depend too on your proximity to them over a series of days, let's say, that force a quarantine of you yourself. And so I think looking at the, what my best advice would be to get in touch with your health providers and or the medical staff that we have put together to try and steer some of the nervousness about what this pandemic means.
All right, back to you, Angel.
Those are all the comments that we have at this time. Mayor Wallace.
So, you know, and go back to that real quick. I just thought about my apologies, Dr. Avery. For individuals that may be identified as positive or may think they may be positive, what is the proper channels through the school district? And then what is the school district and how is the school district operating with City Hall?
I think, and one of the things that we on our COVID-19 page in the district, we do have the step-by-step process that we are encouraging our staff to do. If they feel sick or they feel one of the family members are sick, they can kind of go through, and it kind of gives you the protocol of what to do. Becky or Diana, can you chime in on that and give a little bit more detail?
So what we added today, this is Diana Rios Rodriguez, the Assistant Director of Health Services. And what we added today to our website is the CDC self-checker. So there's an opportunity for people who may be feeling sick and not sure if their symptoms may be related to COVID or not. So what it does is it guides you through the process, and then it'll let you know if you need to seek assistance, or it'll lead you there. From what I also understood is some of these self-checkers were also going to guide you to a testing center that was in your area.
Thank you, Ms. Rodriguez. Again, I think that was one of the ways that we wanted to kind of make sure that we supported our staff. And again, that our website and our page on the website changes daily, and we add additional information based on the comments that we're getting through with our staff, and being able to give them a little bit more support. And so that was an additional ad that we added today on our website.
All right, and you said we don't have any additional questions right now, right, Angel?
Yes, no additional questions at this time, but just to kind of reiterate what Dr. Avery was saying, that link for everyone wondering is manorISD.net/coronavirus. Got it.
And so real quick, until either some more questions come up or we just go ahead and close after these remarks. So real quick, just to cover some things on the current order. This order went into effect on the 24th at midnight, goes all the way until April 13th. If you read in section 3, it talks about all the prohibited activities, which are public and private gatherings of any number of people occurring outside a single household or dwelling unit. So just make sure you understand that. So it's really supposed to be restricted just to congregating with your immediate family. Same thing in section 4 talks about travel, that all travel, including but not limited to traveling on foot, bicycle, all the different type of methods, should only be for essential activities. And essential activities is listed in Appendix A of this order. And then for some of those essential activities like childcare, school facilities, and so forth, there goes into aspects of health care measures in exhibit, I said appendix, but exhibit B. And then if you look down into section 6 with definitions and exemptions, section 6A talks about individuals experiencing homelessness. And so you really just need to take this into consideration, that this piece right here is applicable to everyone. And it's saying even if the homeless individuals must maintain social distancing of at least 6 feet from any other person, that means the rest of us also have to maintain 6 feet from each other, outside of our immediate family. Now that means any restaurants that or stores or outdoor type of places or providing services like the golf course, you need to probably put some type of 6-foot indication, so you are helping people to stay cautious of that 6-foot rule. I know Walmart has done that. I appreciate the manager over there. Me and him have been steadily talking to make sure that Walmart is abreast of the most recent information before it comes out. So because we have a lot of foot traffic going into the Walmart area. And then you have under essential activities for section 6, you have for outdoor activities. And as we spoke about before, walking, hiking, running, and there's other things in Exhibit B that give a little bit more health precautions when you're going outside doing health activities. But again, these outdoor activities are really more so of if you're within that 6-foot social distancing, that is your immediate family because you're already amongst each other inside your house. If you are outside, your kids are going for a walk or whatever like that and engaging with another family or individual outside of your immediate family, you need to make sure you are exercising that 6-foot distance as a current precaution measure to go to a 90% reduction in the spread of this COVID-19 virus. And from there, you have the pieces of some people did ask about returning home. What if I'm in one county versus another county? Well, all 5 counties are exercising this shelter in place. So Williamson, Hayes, Bastrop, Travis, and I forget the other one, but we're all exercising this shelter in place. And we're hoping that over these next 3 weeks, if everybody actually does this, we're hoping to see a significant drop in new COVID-19 cases. If we see that indication that there is a drop, then we can be able to, as elected officials and the county judge, potentially be able to relook at less restricting efforts. We know that the social distancing is taking effect. Right now, the number of cases that keep adding up is what is driving these new orders and will continue to drive more things to be shut down to enforce the social distancing. Let's see here. When you talk about social services and charitable organizations, we have a lot of those organizations providing services and support within the community. At least here within our city, we are striving to have all of those efforts aligned with our 6 task forces to make sure there is some type of structure and system. So when people need effort, support, and assistance, everybody is working together. And everybody knows if who is more proficient in certain areas than another person. So just kind of keep that in mind. And for critical trades, we are really looking at that where Ms. Monique Celadon will assist us as a city to know whenever we need to utilize someone with a particular skill to fill a need, we can be able to activate them as an essential person. Same thing with these nonprofits and charitable organizations. Depending upon what they're doing and what the city kind of needs to be done to help the community, by working with our task forces, working with with our 6 leads, it makes it easier for us to be able to identify and then be able to allocate an individual or entity as an essential need based on our current efforts. And let's see what else here. So that's what you kind of really have in regards to the order and how we're executing this order. If you are not working with our team and we do not know exactly what you're doing and how you're assisting, just know that there are certain rules through FEMA legislation that we are not going to be able to provide, to be able to give you guidance and assistance to make sure you do not end up being in violation of anything, that what you're doing does not potentially get shut down. That is not the intent and the desire here for what we need in the city of Manor. We all need to work together. I hope everybody aligns so we can make sure everybody is plugged in into the right areas of need and assistance. And also with that, just wanted to kind of give some information from my White House calls. And so from some of my White House calls, we've had the vice president on there. We've had some of the undersecretaries and seniors from the different administrations. And most of you have heard that this virus is 3 times more infectious than the flu. And it's because we have never encountered it. It has never, our immune system has never had to fight it off. And so therefore, we do not know how it's going to act. And if you look at the numbers and the stats of the flu, you know how many deaths we end up having per year. So with something 3 times more infectious, our concern is we could potentially see that many times more deaths. And the only way to reduce that potentiality is for us to enact this social distancing to mitigate the ability of one of us passing that virus to someone or us receiving it. Also, you've heard numbers as far as elderly population is 28% more likely of catching this virus and potentially having some type of issue. Highly more likely to have death occur. And then right now, I said again, the ages of 28 to 44 are the main populations that are being hospitalized. Some of us could probably say because not listening, not self-monitoring, but just know the ages right now are 28 to 44. You've seen from Travis County, they're 20 to 60 range of the most cases that are of positive COVID-19. So everybody's susceptible of getting it. You may not always have a sign or symptom, but you potentially could pass it on to your elderly individuals without knowing. There have been some cases of even infants having COVID-19. So we just need to make sure we're assisting and supporting everyone's health because we do not know if they get it, how their body will react, right? And then the life expectancy of COVID-19 is we're expecting new information is coming out, but it looks like COVID-19 can live a little bit longer than 3 days on a surface. So it becomes even more pertinent that you are washing your hands, you are using sanitation wipes and so forth. And that leads me to Dr. Avery. Can you speak on the schools where you had the 2 cases of the COVID-19 so everybody can know the measures you're putting in place to make sure those campuses are good to go before you reopen them?
I think one of the things is that we're going to be having professionals come in to disinfect those particular areas or buildings that are that have been somewhat compromised. So we're going to really take the CDC's recommendation of airing them out. Right now, we're restricting all entry into the building in order to make sure that we do our due diligence in going in. So again, I think a professional perspective is the best case scenario as I talk to my team and our health officials. And so that is the protocol that we will be that I have directed them to do moving forward. So we're already have a plan in action currently, and and we will execute that plan and make sure before anybody else enters those buildings.
Appreciate it. And, so I've kind of said, hopefully answered people's questions, hopefully answered some questions.
We have one more question in the chat.
Go ahead.
We have one question from Ms. Fowler asking, where can the community find all this information? Is it on the city website?
So the task force recently I have asked the task force to one, kind of identify their essential personnel, but then two, to kind of consolidate all their information, contact information into a directory or publishable information sheet, so that it can be all located in one area for everybody, because there is a lot of things going on and we need to be able to try to streamline that information. So one of my biggest things that we're trying to do is mitigate what we kind of call in the military barracks lawyers, or people that may not be fully informed or have the right information, giving information and guidance to other people, resulting into issues or things that are counterproductive to what we're doing based on the most new and accurate information. So those task force are working on that. Hopefully we'll have those things streamed out and officially published in the near term. But until then, again, the contacts are Monique Celadon, Dr. Karen Smith, Father Alex, Rebecca Lott, Dr. Avery for the school stuff, and the other individuals on the internal side of the team. So that's currently where we're at right now. I do know on this Facebook stream, if you go into the Facebook event that I posted, there are links to resources that the school district has provided on their page, where City Hall has information on their page, and where the county has information on their page. So you can be able to use that right now until we're able to provide our internal city contacts and informations for those volunteering and assisting.
We have one other question.
Go
This is a
ahead.
question for you, Mayor Wallace. It's Mr. Getz asking, did you hire a communications person for the city? Asking for a friend. I love being a teacher.
No, we have not right now. And some of the other areas and efforts we were doing regarding economic development, the community collaborative, those things are on halt. We have a more pertinent and more essential focus right now. So a lot of the communication is coming from me top down. I felt, and the team did as well, that this needed to be something handled directly out of the office of the mayor. So a lot of the communication regarding COVID-19 is coming from me, kind of unclassing certain information that I see can be shared to the community at large, and some information that is confidential or secret, quote unquote secret, just to the internal team. So they're planning with at least the most recent information that can be that can be shared with them. So doing a lot of efforts. One of these collaboratives with the school task force is working with Dr. Avery, the board of trustees, to be able to utilize their Zoom and their communication efforts, while Tom and Heath over on our side at the City Hall continue to move forward to expedite some things we already had planned when it came to communication.
And Mayor Wallace, I can add to that. This is Dr. Avery again. Again, it is a collaborative effort. It's, for the city and for the school district, we will be able to, assist in any type of communications to our community through the school, and support the city in any way that we can to collaborate and collaboratively from the school board, myself, my staff, anything that we can do to assist to get the word out to the community. We will be more than willing and able to assist the city in doing that as well.
Right. And I would say this, this is a time, just continue to keep calm, be informed, be aware. The information I'm sharing is so you are as best informed about what is going on as possible. It's not to alarm, it's not to create hysteria or anything like that. Just so you have the most relevant information, you see what's going on, you hopefully understand what we're doing and what we're asking you to do. So you have a greater desire to do what is being asked of you. So just keep that in mind. If you believe someone happens to be positive, whether someone says that they're positive, it does nothing good to try to call them out and try to shame someone, which could potentially result into targeting someone, which creates a total another issue within our community. We all need to, as Tom said, we all, or should I say, Chief of Police said, we all need to act as if everybody has it. And if we believe someone does have it, then we just need to leave them alone and move away and go somewhere else. If we all have that mentality first, then even if someone does have it and is not listening to the guidance, is not listening to stipulations placed on them, then you will not get it. Make sure you have wipes, make sure you have hand sanitizer. When you're going to Walmart, you're going to restaurants, make sure you're wiping stuff down. You don't have to do it excessively, but just make sure you're wiping stuff down to make sure that you are okay to go. Everybody is trying their best to make sure all surfaces are clean. But you also need to take that extra precaution. We all forget things sometimes. We all get overwhelmed. So please take the precautionary measures for your own health. And is that it, Angel? Do we have anything else?
We did receive another follow-up question, but I believe it's a repeat from Ms. Lauren Schaffer-Manker asking, what about all the people that have been at the golf course? But I believe you did address the golf course earlier.
Yes, we did. And this real quickly, it's basically certain measures have been put in place with that golf course. If they violate those measures, our chief and city manager are authorized to close the golf course down. So with that, I open it up to Tom, Dr. Avery, your team. Any closing remarks?
Very briefly, I'd just like to mention to everyone that the video will be posted to Facebook after the stream is done.
Again, for the school district side, I think the critical part is that we will be starting e-learning and academic packets give out on Monday at all 3 food distribution sites. Again, I want to direct our communities and families to our webpage for additional academic and information from the school district. And that's going to be www.manorisd.net. Thank you.
Tom, you have anything?
We've had questions regarding construction and the need to stop it. Travis County's order is different than many of the other orders throughout the state where construction is allowed to continue. Within Travis County, it is to cease. And so the steps that we've taken to do 2 things. Number 1, comply with the order, but also to protect some of the investments that the builders have made, is to allow them to button up structures so that they're not damaged by rain and weather over however long this takes, in anticipation that maybe the order will be changed to allow construction. For that reason, the word is, and it has to be, that we will not be issuing new building permits. Inspections will come to a halt within the next couple of days. No contractors may be in a facility that any of our inspectors are in order to maintain distance separations. So just wanted to put that out there that even construction needs to come to a halt, depending on whether or not the order is amended.
Appreciate it. And you know, the last comment that was just popped up, you know, the golf course and a lot of other things may not seem essential to some people, but keep in mind, some people use golf as a stress reliever. Some people use drinking as a stress reliever. Some people use some other things as stress relievers. So us at the city level are trying to make sure the different avenues people use as stress relievers are available to them. If it is misused and abused against what the order has in place as far as social distancing and the measures we have mandated to those entities, they will be shut down. So just keep in mind, even though something may be open, majority of the time it is because it falls within an area where we're trying to mitigate additional stress and anxiety for some that we know that is a highly utilized aspect for them. People that are right now that golf a lot, that may be a way for them to relieve their stress. But if they continue to violate the order, they will be shut down. You've already heard about the parks. They've already been shut down. However, if you end up seeing someone that's parks within this that the city owns and parks that the school district owns, if you have an issue with parks in your own HOA, that is a conversation you need to have with your HOA board. Okay, so just keep those things in mind. And if you see someone or a group of people just outright violating the order, you need to inform the police department. All right.
Mayor, if I could, we're leaving the trails open for exercise within the parks. None of the facilities that are within the parks would be available to use, but we didn't want to remove the opportunity to walk the trails.
Thanks. And so with that, Angel, I appreciate you coordinating this. Dr. Avery and your team, I appreciate you all taking the time out to be on this. Tom, I appreciate you carving the time out your busy calendar. So let's all get back to work on fighting this COVID-19. Yeah.
Thank you, Mayor.
Thank you.
Thank you, Mayor. At this time, I will be ending the live stream. For those of you that are still joining us, this video will be posted shortly.